ready now, finally, after all of that prep, to get our meds ready and give them to our patient. The first scenario we're going to go through is that Armando arm has a saline lock, okay? So we are going to give our vancomycin and our furosemide through a saline lock. So you can see that when you're looking at your IV med list, there's a procedure for existing line and saline lock for both of these. So I'm going to show you what it looks like to give both of these meds through a saline lock, and then we're going to go and give both of these meds through an existing line so you can see both scenarios. You don't know what scenario you're going to get in your checkoff. You may have an existing line, you may have a saline lock, so you need to be prepared for both. One thing I also want to mention is that if you have been here since block 1 and you still have your med cards, which I hope you still have, that you made with Professor Collins in block 1, you may just make sure you can update your med cards to have past med on them. Make sure all that information, hopefully all that information is already on there. You may just have to update it with, maybe some med math or something like that, some things that you might want to put down, but otherwise, as long as past med's on those cards, I will let you bring those cards in, or if you want to make some med cards, I will let you bring past med cards in, because of course those are great resources for you to use as a nurse. If you have those cards with you, you won't have to do a drug lookup. If you're in clinical, you already have your past med ready. So just update your past med, update your med cards, and feel free to use those as well. But again, I can't tell you what meds you're going to get in checkoff, so you may have a med card for them, you may not. But look at your drug book, look at this. So we are going to be in a med room. In a med room, you should be using a clean space. Again, if you're using your bathroom counter or your kitchen counter, I understand it's not a clean space. In a pharmacy, they are very, very, very sterile, clean chlorhexidine space. They're under a hood. They actually discourage us from mixing up meds on the unit. This is probably not going to happen very often, except if you need to pull up a push. But you should always, I know there are nurses that pull up meds and do it at the patient's bedside with a urinal on the table, and it's disgusting. Please try to pull up your meds in a med room where it is at least a controlled environment and somewhat clean, without patient body fluids on a bedside table. Don't mix up meds in a room. Do it at the med station. So I'm going to wear a mask because it is best practice, not only now with COVID, but it's best practice in general to mix up meds with a mask on so you're not breathing onto the meds. Also, wash your hands thoroughly at a sink, soap and water. This is aseptic as possible. You're taking meds that we're going to be putting in an IV that could give us a bloodstream infection. We want this aseptic as possible. So we're going to wash our hands. Or if we arrive in the room, we're at the very minimum going to hand sanitize, but we should wash our hands with soap and water prior to. So I am hand sanitizing and gathering my equipment here. I have my 2 meds that I'm going to pull up. The flushes are for administering. I'm going to put those off to the side. I'm going to need to pull up these meds into a syringe and pull them out and get them all mixed up. I know I'm going to need this is a 100 milliliter bag. And this is a saline lock. You can see that we're also going to need, if you look at your list, we're going to need a primary IV line, not for the IV push, but for the secondary. All of our secondaries, we run with a primary line. And when you come into practice, I will demo to you why we have to put a primary line up with our secondary. So the first step I'm going to do on this, because it's a saline lock, I've already gone in and looked at my patient and seen that he has no IV fluids running at all. He is saline locked. So I am going to use my primary IV line, which I know there's an easy way to, there is an easy side to open these, if it's already open. And one of the block 2 skills was spiking and primarying your primary line. So this should be a block 2 skill that we're redoing. We're going to cleanly spike our thing. Now, at home, you don't have an IV pole. Hey, I don't have an IV pole in my med room. I have a paper clip. I think you have a paper clip. And I'm going to hook my paper clip on here to prime my primary line. You can get a command strip hook at home and put that somewhere to do this as well. But I'm going to go ahead and just prime this line. And all we're doing is priming it and clamping it, okay? I never took off the top. I've never touched the end. It is still clean to take in the room. I'm going to leave that hanging there. We're going to take that into the room with us for our secondary through the saline lock. So that is ready and sitting over there. We're going to get our meds ready now. Keep all your stuff. All right, so let's do our furosemide first. This is our easiest one. We are going to pull out 1 milliliter from a vial, and we're going to give it over 1 to 2 minutes. So the pulling it out of the vial is anticlimactic. I'm going to just go ahead and wash my hands again, just because it's never too hard to wash your hands. We are going to clean the top of the vial. Okay, we want that to stay clean. And in the meantime, you can clean the top of your other vial too if you want. But we want those vial tops to be clean. And I'm going to get, now I don't have a 1 milliliter syringe, but I wouldn't recommend pulling 1 milliliter into a 1 milliliter syringe anyway, because then your plunger is going to be at the very tip. So we're going to use a 3 milliliter syringe on here. And then we need a needle. So I don't know if your syringes come with needles or if you need to pull needles out, whatever you need to do. We're going to prep our syringe here. I'm going to pull up 1 milliliter out of the vial. So we had 30 seconds of scrub, letting that dry. Pull back on your syringe 1 milliliter so that you have some room in there. We're going to put it in the vial, inject that air into the vial, and that's just to prevent causing a vacuum, and it's easier to pull out your med. And you're going to pull out a milliliter. I don't know if you can see. We're going to pull out a little more than a milliliter, get the bubbles to the top, and then inject it to right at a milliliter line. You will show this to your instructor. I've pulled 1 milliliter of furosemide, 20 milligrams per milliliter. So there are 20 milligrams of furosemide in this syringe. And at this point, you do not need to recap. I know you're going to reuse these needles. But what we would do here is take this out and we would drop it in the, if we were in a clinical environment, we would drop this into the sharps box. But then what do you do with the tip of the vial? Oh, and that's something we don't have in our totes, our blue caps. So what I'm going to do is I don't have a cap to put on here. In the clinical environment, and we do have this in the practice environment, you can drop this into the sharps and then cap this with a sterile cap. We do not have that, so I'm going to leave the needle on and I'm going to recap my needle the way you were taught to recap.
And you're going to
Scoop it up. All right. Now, I'm not going to drop this on there because this needs to be labeled. This is medication. I don't want anybody mistaking this for saline or anything that it is not. So at this point, I'm going to write my labels. Where did I put my labels? I had them.
Did they end up back in the bin?
I had all my address labels. Well, I'm going to take this. And I'm going to write on here, what do you put on your labels? We're going to put on there the name of the patient. So this is for Armando Arm. You don't have to put room number or anything. We just need at least the patient's name, and we definitely need the medication and the dose that is in here. So this is furosemide, 20 milligrams. And what I would recommend is if you're not using a giant Sharpie and you're using a nice ballpoint pen and you have a decent label, write your push rate in there. Write 1 milliliter a minute. Because then when you go to the bedside and you have forgotten how fast to give this, it will be on your label. We are going to label this syringe. Make sure you do not cover up your markings so that you can see. If you're going to give this 1 milliliter a minute, you want to give it half a milliliter every 30 seconds, you might want to time yourself. Do not cover up your markings. So this is labeled and ready to go into the patient's room. Now we're going to drop our vancomycin and get that ready to go. And to do that, we are going to draw up 5 milliliters from the vial. So of course I'm going to get the next biggest size. We're not going to drop 5 milliliters. We're going to put it in the 10 milliliter. We need a needle. Get our needle ready to go. And we're going to get our bag ready to go so that once I pull it out of the vial, I can go ahead and inject it straight into my bag. And we have a 100 milliliter bag. I know it's 100 milliliters. And we've cleaned that off. I'll let it dry. And we're going to pull back in our vancomycin, 1 gram, 10 milliliters. Draw back your 5 milliliters. Push it into the vial. And these vials have been poked many, many times, so they're drippy. I pull back a little bit more than 5. And I like to stabilize it like that while I push, because otherwise the bottle's hanging there, it could bend the needle. Get the air out of the syringe, or get the air to the top of the syringe, and push back up to 5 milliliters. So now we have our 5 milliliters. You may go straight into the bag here. This came out of a sterile bag, so this end is still sterile. If you want to clean it, I will have no problems with you cleaning the end of a bag. I'm about to put a needle into something. I want it to be clean. I have no problems with you cleaning that end of it. We're going to put the needle straight into the bag. Be careful not to puncture yourself. We do have some blunt needles here at the school that you may come across. I don't think the blunt needles will puncture through these bags, so the needles from the kit are the best ones to go in here. This can now go straight into your sharps container, and now this is what has your medication in it. I'm going to put it aside because I'm not going to throw it away. This is what has your medication in it. This is a 100 milliliter bag with vancomycin. So, oh, my labels are right here. Lord have mercy. So I'm going to put a little label on my bag. And somewhere I put my pen. Here. And again, this is for Armando arm. And this is vancomycin. 500 milligrams or 0.5, whatever you're going to write, as long as you write the dose of the bag. You don't need to write in 100 milliliters. The 100 milliliters is right there on the bag. So at the very minimum, this is for Armando arm. This is vancomycin 500 milligrams. And when we mix up a bag, if we're not going to administer right away, we're going to write, when we mixed this bag so that they'll know how old this bag is. And when you get the labels here, these labels are great because they tell you everything to write down, and everybody spends time filling all it in. But patient name, room number, rate of infusion, date, time given, mixed, it has all the stuff on there. Again, the bare minimum is the patient's name and the medication in the bag and when the bag was mixed, so that you know how old this bag is. So when you get those labels, you may want those. So I have my 2 meds that are ready to give, and I am ready to go in my room. I have my vancomycin. What do I need to administer this? I'm going to need my secondary medication set, and I need my primary IV bag. So all these things will go in the room for my vancomycin. And then for my Lasix, for my furosemide, you're going to see that we need to flush it before and after. So I'm going to take in at least 2 flushes. So I like to med flush. And for this one, I'm going to give the furosemide first because it's always better to give a med that you have to push first before a med that's gonna run for an hour. You wanna go ahead and get your push in first. So I'm gonna flush, med, flush, and then because I've used the flush here, I don't need to flush before this one because everything you should always remember, flush, med, flush. But if you've finished with a flush and then you're hanging another med, you don't need to flush again. So flush, med, and then we'll flush again when we're done, okay? So I have everything I need to go into the patient's room. The last thing I want to bring in the room with all of this is something to label this line to let me know when I put it up. So I'm going to take one of my little change labels into the room. Again, you can pretend at home that you have a change label or just take an address label or something, but basically something to label your IV line of when you hung it up. And the last thing is just a couple extra flushes and a bunch of wipes just for safety. And we get to go to the patient's room.